Love Island participants starting to perform an injectable procedure on their patient. Lip King in Manchester running a successful clinic and giving his opinion on TV. What's really going on in aesthetic medicine world in the UK? I have two colleagues, experienced medical practitioner and aesthetic specialist, to give opinion on unregulated aesthetic medicine in the UK. Dr. Claudia and Dr.Rorry. So guys, what do you think? Which way we are moving in?
I think unfortunately with TOWIE and Love Island, you are finding that there are some people who are saying they're training in Botox and fillers when they are not medically, they're not even beauty therapists, some of them. I think it's really dangerous. They have no knowledge of the anatomy. They are purely doing it and marketing the young, vulnerable girls who they think are going to go and see them because of the celebrity status. But without knowing the anatomy, without knowing the complications, and being able to deal with whatever complications arise, it's so dangerous.
Dr. Rorry, you also work in maxillofacial department.
Yep.
What is your opinion? Do you believe that someone without any medical background have just done a 1 day, or even let's just say the best, they have done a week course, a month's course, would they be able to learn all the anatomy that we as a dentist or doctors learn in university? Would you compare it? It will be on the same level?
No, not in the slightest. So we've all done an awful lot of training to get where we are. And I think what a lot of things these people forget is that this is a medical treatment. These are prescription drugs that we're giving to people. And so with the lack of regulation and the fact that anyone can set up a clinic on the high street, actually the risks of complications with the amount of aesthetic treatments that are going on is only going to rise. And we see it as a result in our hospitals, people coming in with botched cosmetic treatments. And whilst none of it is life-threatening normally, actually it can be quite life-altering. And so people, as you say, Claudia, on TOWIE or Love Island, just setting up shop on the top of above a shop in a high street, actually are putting these people who are quite vulnerable sometimes at significant risk of coming to harm. And so I think the time for regulating this industry is long overdue.
Well, I couldn't agree more with both of your opinions, and thank you very much for such a valuable contribution. Unfortunately, at present time, it's only down to a patient to make the right decision and go to medically qualified. I would like to highlight this again. Only medical professionals should be performing this procedure, and with the right amount of training. And we also train medical professionals, and I believe that a lot of medical professionals realize that aesthetic is a not 1 day training. Correct me if I'm wrong.
Definitely not.
No,
it requires
no.
years of training, and even this far down the line, we've all been doing it for a long while. We still keep up to date because things move on. You can never know too much. So it's really important.
Yeah, I'm surprised at the number of questions I still have, despite doing this for a long time. And I don't think you ever stop learning about this sort of thing. And so this is not a 1 day course industry.
Absolutely. Well, thank you very much. And again, please choose only medics.